Hi, I'm Alice Kingdom. I'm a well-known microblading and PMU trainer, and welcome to one of the series of my hints and tips. You can view a number of these in my YouTube channel. I also have various blogs and other avenues where you can get help and information about treatments to improve your work. In this section, I'm going to talk a little bit about scarring. Does microblading, does semi-permanent makeup work on scarring? Yes, it does, but there are a few things that we need to be aware of if we're working on a scar. So scar tissue is a little bit more unpredictable than sort of normal virgin skin. In most cases the scar is there because of a trauma, because someone has been hit or burned, or there is some reason that maybe hair doesn't grow quite as well, maybe the skin texture or feel isn't the same in the area, and therefore we need to be a little bit clever about how we work the skin and a little bit clever with the expectations with our client. So with scar tissue, sometimes scar tissue can hold on to more pigment than expected, and sometimes it won't hold on as well as expected. But we always want to work lightly. If we work lightly, we have an opportunity to go back and build in more saturation, more depth of colour. Whereas if we work too strong in the first instance, there's no kind of way to come back from that. So when you're working on scarring, make sure that your clients have really clear expectations with the fact that the retention may not be as good in those scarred areas, and make sure that you're working really lightly. As I mentioned, we can always do a little bit more. There are some things that we can do to help scar tissue to have better retention. Making sure that the skin is well conditioned. So if the scarring is thick or heavy, then potentially some dry needling or micro needling sessions before we do the treatment can be really helpful. And also to work the area using pointillism. So rather than going in with a 1RL or a shader needle, maybe using a 3RL to gently tap in with a pointillism technique in the area, and that can just encourage a little bit of an additional hold while still remaining gentle on that skin. I hope that helps, and please stay tuned for other hints and tips. If you have any particular questions that you would like to ask about working on scarring, please feel free to pop a comment.